Okay, so it is 4:30. We'll go ahead and get started. That way we can hit on everything, and there should be some time for additional questions. But I do have the questions that have been submitted so far. So my name is Dr. Brandy Roane. I am a clinical health psychologist by training. I specialize in sleep. I'm an associate professor at the University of North Texas Health Science Center, and I have a dual appointment with the Pharmacology and Neuroscience Department in the Graduate School of Biomedical Sciences, as well as the Medical Education Department in Texas College of Osteopathic Medicine. So how I typically do this is really going off of questions that were submitted. That being said, I do have my chat open, so if there are any additional questions that come in, I will try to ensure that I'm able to bounce off of it. But let me go ahead and share my screen because I have some slides that'll, in essence, help us to answer those questions. Yes, everybody, all the panelists are automatically muted, so you are good to go. Okay, so we're talking about sleep health today, and what I'm going to do is base this off of the questions that were sent. So some of the questions that were sent in, and we'll likely answer some additional things, or some additional things might come up. This is a great question. So I'll definitely address napping or resting. So right now, the questions that I received initially were, why do I wake up so often during the night? How to fall asleep quickly. And I've clustered these together based on how we're going to kind of move through the slides. Those are talking about things more specific to sleep disturbance, such as insomnia, so when we have difficulty falling asleep or staying asleep. And then we have some other questions, like what are some good ways to wind down or relax before sleep, how to quiet our mind when we have a lot of things to deal with at the same time, how to ease my mind so I can get valuable sleep. My mind races, it's difficult to stop thinking about everything, work. And these are kind of clustered in with some of these aspects, but these get to more sleep habits and sleep behaviors. And how can we maximize rest with the least amount of sleep? And what do I do about feeling groggy in the morning? I've also got the question regarding resting, not sleeping when laying down for a nap. So let's talk about what sleep is. And the reason I'm going to start off here is because understanding how we sleep, why we sleep, is incredibly helpful with regards to, and I just realized that I had my screen advanced, but I hadn't advanced it for you guys, so let me move it forward. I'm so sorry. So in order to answer some of these questions or get a better idea of how to improve your sleep, it often helps to understand what are the mechanisms that promote sleep. So when you are changing a behavior or you're considering or factoring in some of the things that might be impacting your sleep, it's a little easier to do that. So I tend to operate with the idea that knowledge is power, and if you understand the mechanisms a little better, it's a lot easier to start changing behaviors to improve what you're doing. So why be concerned about sleep? According to the CDC, so they came out a few years ago, and in essence, it's sufficient sleep is not a luxury, it's a necessity and should be thought of as a vital sign of good health. And the reason I highlight this is because sleep is imperative. So our circadian rhythm and actually sleeping, and I'll discuss what circadian rhythm is in just a second, are imperative to us functioning throughout the daytime as well as us sleeping well. And we found in studies that when we don't sleep enough or we sleep at odd times, it adversely impacts our health. So we don't do as well, and it can actually promote disease. So let's talk about what is sleep. Well, if you look in the Merriam-Webster dictionary, they define sleep as the natural suspension of consciousness during which the powers of the body are restored. This is a lovely, lovely definition. However, it really does nothing for telling you what is going on with sleep, what can I improve, and those kind of things. So let's define sleep. Because when we use this term sleep, we actually are often referring to several different things. Sometimes we mean how much sleep you got. So how much sleep did you get last night? That's what we call duration. Now that's important to understand that duration is different than time in bed. Time in bed is when you get into bed and when you get out of bed, but often sleep is occurring during that window, but it's not the same length. When are you sleeping? So this is, for instance, timing. So what time did you go to bed? What time did you wake up? How well you slept. This refers to quality, and it's important to understand that this is not solely dependent on how much sleep you got. As a matter of fact, when we shorten our sleep, often our quality sleep is improved because we are so sleepy, but the duration isn't sufficient. So we're going to feel like we haven't slept enough when we get up. And it's very possible to be in bed for a longer period of time and actually have really poor quality sleep because we sleep in a fragmented way. So they're not mutually inclusive. Now, there's two mechanisms that regulate sleep. One of these is our master circadian clock, which is our suprachiasmatic nucleus, which is just a fun word to say because it sounds like supercalifragilisticexpialidocious. But our suprachiasmatic nucleus, it sits in our hypothalamus, and it's going to direct the body's internal circadian rhythms. The other mechanism is our sleep-wake homeostasis, and sleep-wake homeostasis, in essence, tracks your sleep need. Now, it's important to understand these two mechanisms are connected, but they are distinct processes. So let's talk a little bit about them. Your suprachiasmatic nucleus is going to sit in the brain. It's actually in the hypothalamus, and it is the body's master clock. What that means is it operates as both an oscillator and a pacemaker. And what I mean by that is it is going to try to drive and control the rhythms of the body's peripheral clocks. And what peripheral clocks are all the clocks throughout your body. So all of your cells in your body have clocks in them. And this master clock is going to try to set the pace for those clocks. Now, the master clock operates on a duration of about a day. And that's where circadian comes from. It's a Latin from circadium, so about a day. Now, this slide is kind of busy. Don't worry so much about all of the different areas in the brain that we're talking about. Just understand that with that master clock sitting in your hypothalamus, it actually gets entrained by internal and external stimulus. And entrained means it gets synced or set. The most potent entrainer, or Zeitgeber is what we call it, is light. And light is going to reset the master clock on a daily basis. When light enters the eye, it actually is received by a very special group of retinal ganglion cells that determine brightness, not duration of light exposure, but brightness. And that is going to send signals to the suprachiasmatic nucleus, or that master clock, via a couple of pathways. One is a direct pathway straight from the retinal ganglion cells. The other is an indirect pathway that kind of goes from the retinal ganglion cells to a different part before connecting back to the hypothalamus. And this is going to be mediated in terms of how we respond to light based on a third component, which is the RAFE nucleus, which is determining this or sending signals via serotonin. Now, how we can better understand this is if we look at something called a phase response curve. And what a phase response curve is, you'll see on this right here, is throughout the day, how we respond to light is based on the time of day and what our brain is expecting to happen. When we receive light signals during the midday, and that's at panel A right here, you'll look up here, our circadian clock doesn't change. So it's almost zero impact, which means during the middle of the day, when you're out in the sun and that kind of thing, that's great for vitamin D, but it's not necessarily going to cause a problem with your circadian clock. as we get closer to a transition between our subjective day and our subjective night, we start to notice that light exposure will do what's called a delay. What that means is it pushes your sleep onset time later. Our circadian clock thinks it's an earlier time than it is. So we're going to push off trying to start sleep until a later time. It's a pretty small, so about 30 minutes. However, if you get to the beginning part of the subjective night, you'll notice that with panel C, you suddenly have a really big jump in that timing. So this is, for instance, if you are, so it's going to be around dinner time and you're sitting down and you have all the lights on in your house and you're eating a meal, but you have all the lights on. That bright light exposure is going to tell the circadian clock to delay by about an hour. Then as we get into the night, you'll notice something different happens. When we get light exposure, for instance, in the middle of the night, so this could be if you got up to go to the restroom and you turned on the overhead light when you did because you needed to be able to see, you're going to notice this is what we call a phase advance. What this means is our circadian clock shifts earlier. So we're going to try to wake up earlier. We're going to want to go to sleep earlier, those kind of things. As we get closer to morning time, when we're going to have that transition back to subjective day, we have a smaller shift in that phase advance. So that kind of gives you an idea of how light exposure can impact what's going on. Now, I'm going to skip the next slide. I'm going to move to this one. The reason for that is because light is not the only thing that entrains our internal clock. The other thing that entrains our internal clock are external stimulus. For instance, when we're interacting with others, how interactive we are, the intensity level, that stimulation will actually feed into the circadian clock. And if there's lots of stimulation, it will tell the brain that it still needs to be promoting wakefulness versus promoting sleep. When we're physically active can also feed into that clock and try to entrain it. So if we're physically active closer to bedtime, it's going to tell the clock that it needs to delay and keep us awake later. When we eat meals also does this because our circadian clock regulates a lot of the hormones that are important for metabolism. And vice versa, that system, those hormones and what's going on with what we eat feeds back into the clock to either help promote a regulation of it or a possible disruption. So for instance, foods high in fat promote a disruption in the master clock because they send back disruptive signals based on being stored as fat tissue. Fat tissue actually will send back disruptive signals and cause a dysregulation in the master clock. So, I'm going to move through real fast. I want to see, because based on where we're at, I want to make sure that I talk to you about, okay, there we go. I just needed to double check. It's harder when I'm in presenter mode to pick my slides that I want to go to. But if you want to consider your circadian rhythm and what's going on, this is kind of how it plays out in terms of all the different ages. So by age 2, our circadian rhythms have started to become entrained by our own intrinsic trainers and extrinsic. It's no longer being driven by mom's circadian clock, which is what entrains a fetus's circadian rhythm. You'll notice that there's similarities throughout the entire lifespan. There's just less the amplitude is a little bit reduced as we get a little older. Now, the second process that's important for sleep is our homeostatic sleep drive. And this is a pressure you feel to sleep. It's sleep dependent. Sleep pressure is going to build throughout the day. The longer you're awake, the more pressure you build. And when you sleep, it's going to let this pressure off. What's important is it's actually going to be let off during a very specific stage, which is deep sleep. And this homeostatic sleep drive is going to impact how long and how deeply you sleep, because the more pressure you build, the more likely you are to try to sustain sleep for longer because you're going to try to get rid of that pressure. It can also cause some dysregulation in your sleep architecture, meaning you're going to try to stay in deep sleep longer than you normally would. Now, this is just to highlight that there are different brain pathways that promote wake versus promoting sleep. And in order for these to work well or work together, we have what's called a flip-flop switch. And this flip-flop switch, in essence, is when we're awake, we're going to have certain things being stimulated to promote wakefulness. And it's going to inhibit certain pathways so it doesn't promote sleep. When we transition to sleep, it's typically a pretty rapid onset, which is why it's called a flip-flop switch. And what's going to happen at that time is certain pathways are going to promote the suppression of wakefulness. And we are then going to fall into sleep until we reach the end of our sleep period or something rouses us, and then we wake back up. Orexin is a neurotransmitter that is important for stabilizing this flip-flop switch. And this, if you've ever been so sleepy, so for instance, you stayed up super late or pulled an all-nighter and you realized just how quickly you could suddenly fall asleep the next day, that's where this kind of flip-flop switch becomes more obvious. When you're transitioning to sleep at nighttime, it's kind of a little bit of a slower transition, but there is a point where that flip-flop switch does that, and then you're into sleep. Orexin is important for maintaining the wake-promoting pathways because there's going to be dips in how consistent those pathways are, so orexin acts as a stabilizer. And what's interesting is people with narcolepsy have a loss of that neuropeptide orexin, and as a result, they can't maintain wakefulness, and they're going to have transitions from wake to sleep during the daytime when they shouldn't. So let's look real fast at how these work together. So this is kind of in action. What's important is your circadian rhythm is really a wake-promoting system. So it's going to try to promote wakefulness. That homeostatic sleep drive instead is going to be that buildup of sleep pressure to a point, as you'll notice about right here at the beginning of the night, where it is going to override and it is going to help promote sleep onset. As you sleep, you let off pressure and then you start again. When we don't sleep enough, we retain pressure in that homeostatic sleep drive. So think of it as a pressure, literally a pressure tank. If you sleep sufficiently, you let off all the pressure. If you don't sleep sufficiently, you're going to wake up in the morning and have some pressure left. So that could be one explanation for why you are waking up feeling groggy, is if you have extra pressure in your system because you didn't sleep sufficiently, it is going to want it, you're going to feel sleepy. One way to tell that is you'll notice here, we have a dip in our circadian rhythm that occurs about 2 to 4 in the afternoon or 3 to 5, depending on your rhythm. So how does this look? If you ever have that dip occur, so that 2 to 4 time period where you feel groggy or sleepy in particular, such that you need to take a nap, typically means you haven't been getting sufficient sleep, because it means that when that circadian clock pulls back promoting wakefulness, you have more pressure in your tank than you should for that time of day, so it's going to want to drive sleep. If you are getting sufficient sleep, you might feel a lull in your energy, but you're still going to be able to maintain wakefulness. Now, when we nap during the daytime, after about age 7, because we give up naps naturally by age 7, meaning we do not any longer require them. So if you're wanting to lay down for a nap, it typically means you haven't gotten enough sleep the night before. But when we nap, your sleep pressure not only stops building, but it starts letting it off. Unless you keep your nap, typically means you're not getting enough sleep at night or something's disrupting the quality of sleep. And so if you are napping, it's trying to basically make up for either the shorter sleep duration or the poor quality sleep. Now, here's the thing with naps. If you nap for 20 minutes or less before about 2 o'clock, the likelihood it's going to disrupt your sleep that night is minimized. The reason for that is with the 20-minute marker, meaning from the time you lay down to say, I'm going to lay down, rest for 20 minutes, you typically will not be able to go into deep sleep. So if you're not going into deep sleep, how does the pressure manifest? It's based on staying awake. So if you're staying awake, it's a buildup of something called adenosine in the brain, and that is going to drive that sleepy feeling. We let that off and it dissipates while we're sleeping. The napping, if we feel like we need to nap, means we have too much pressure in that tank, and it is going to promote sleep onset during that dip in the afternoon. Because if you remember, let me click back on my slides, we have that dip right here in the afternoon. And so that dip means that those wake promoting systems pull back to an extent. And if we have too much pressure in our tank, it's going to want to trigger sleep onset at that time. And I don't know if I need to click answer live or whatnot, but the question was, how does this pressure manifest? Okay. I want to make sure I'm answering all the questions. So the next question we had was how to fall asleep quickly, those kind of things. So part of this is really a matter of making sure that you are not taking naps. If you are, meaning you're trying to transition your sleep schedule to allow for sufficient sleep, and in the process, you're still needing to make up for, you're still filling that nap. Like I said, I typically tell patients 20 minutes or less before 2 p.m. How do we stay asleep? Great question. Okay, so let's go through. I'm moving ahead real fast. So one of them is, I'm going to first hit on something called circadian misalignment, because that's also important for how we stay asleep. And the reason for that is if we are sleeping, so I told you, homeostatic sleep drive, our circadian rhythm, they are distinct processes. However, they interplay. And when we try to sleep at a time that isn't conducive to sleep, meaning we're trying to sleep at a time when our circadian clock is trying to promote wakefulness, we are going to then have a harder time sleeping. Oh, how does daylight savings time. We'll talk about that in just a second because it is important. And that gets to the circadian misalignment. So circadian misalignment means our internal clock is not matching with our external clock. When we wake up each morning and get that first light exposure, that's what sets that circadian clock for the day. And it's going to update all the other clocks. If you're consistent with that wake up time, then it is going to keep sending the same signal every day, or roughly about the same signal. And it's important because our circadian rhythm runs approximately 24.4 hours. And that means it's significantly easier for most of us to delay some because we naturally have about an extra 30 minutes that our clock thinks it's going to need to keep promoting wakefulness. So if we allow for that, it will delay us. But if we keep a consistent schedule and have bright light first thing in the morning, it will maintain a syncing between that external clock and internal clock. Daylight savings time affects the circadian rhythm because now our external clock is something different than what our internal clock was expecting. So what that means is our body has to basically recalibrate. And so what that's going to promote is a feeling like jet lag. So you might have noticed following daylight savings time that you felt groggy, sleepy, not hungry at the normal times, all of those things, because we had a dysregulation in our circadian clock. Now, as far as helping to stay asleep or fall asleep, I'm pulling up real fast just to make sure I can flip through to the things that we want to look at. Now, first, let's talk about, and I forgive the fast, rapid go through. So when we evaluate sleep disturbances, we look at a couple of things. And this is important for how do we fall asleep, stay asleep, good sleep habits, those kind of things. We look at sleep patterns. We look at bedtime skills and interactions. We look at daytime skills and behaviors. We look at bedroom environment. The circadian rhythm does not recognize the difference. It's simply detecting brightness. Brightness means lux. So it's a measurement for light. Now, bright light outside, definitely great because it's super, super bright. But there's enough, so I have a tabletop lamp over here. There's enough light that emits from a tabletop lamp to cue the brain to stop producing melatonin. Melatonin is not a sleep hormone, it's a night hormone. And it comes out to play when the circadian clock basically goes, hey, it's about 2 hours before we normally would start doing nighttime things. Melatonin comes out and helps promote the sleep pathways. So our blood pressure is going to drop some, our core body temperature is going to decrease. We're going to have a drop in cortisol. We're going to have things that promote sleep. And when we have light exposure at night, because light is the antithesis of melatonin. So since melatonin is a night hormone, if you get a dose of bright light, it's going to tell the circadian clock not to promote melatonin production. If we stop promoting melatonin production, then our body's not going to prepare ourselves for sleep. Can it be harder to wake up when it's dark outside? Most definitely. How you balance that is you can set a lamp or have a light that in essence comes on. They make alarm clocks that have lights in them that will come on at a certain time, and that will be received by the eye, the retinal ganglion cells in the eye, and tell it that there is or that the day has started. So there's ways to counter that. The other thing is go into one of the two brightest rooms in the house. The two brightest rooms in your house are typically your kitchen and your bathroom. So if you set an alarm clock away from the bed that forces you to get up to turn it on or to turn it off, when you do that, immediately turn a light on, and that is going to help the brain stop producing that melatonin. You're going to feel less groggy, and you're going to be able to sync that clock for the day. Now, when we're talking about sleep, the things to look for. So, how do I know my sleep patterns? So in order to help you fall asleep or stay asleep, it's often best if you are consistent with your sleep schedule. It can definitely keep you from sleeping well because light, like I said, is going to tell the brain that it doesn't need to produce melatonin. And so even if you have enough sleep pressure built up, you are possibly likely going to, most definitely, you're going to have a difficulty staying asleep because we will pick up the light cue and it can actually cause a poor quality in your sleep. We sleep best in a cave, and I'll talk about that in just a second. But if your sleep schedule is predictable, so how I talk about predictability is same bat time, same bat channel. Are you going to bed about the same time, waking up at the same time? Is it predictable in the sense of duration? Instead of some nights you get 6 hours, some nights you get 10 hours. You really want that predictability. That's going to promote a strong circadian rhythm. It's also going to help your body know when it should be ready for sleep. Is it sufficient? So not too much, not too little. Think of Goldilocks. Is it efficient? Meaning the amount of time you spend in bed is pretty much identical to the amount of sleep you are getting. So we as humans have the ability to shorten our sleep artificially. We like to bring things like cell phones into our bed or have TVs on and those kind of things. And what that results in is often insufficient sleep. So in terms of sufficient sleep, what do we mean by that? Sufficient sleep, there's a big table over here that has lots of ranges because it's important to understand there are individual differences. However, some really good markers to go by. Yes, it is possible for people to be natural night owls. So that's where their internal rhythm promotes a delay, meaning they naturally have a tendency not to do all of those things we talked about until a later time. And so you can also have what's called a lark, somebody that is a morning person. They're going to want to go to bed early, get up early, whereas a night owl wants to go to bed a little later, wake up later. It is possible, regardless of your predisposition for your internal clock, to shift that as long as you regulate your light exposure and activities. So even a night owl can learn to wake up at an earlier time. It's a matter of them being able to use light, sometimes even melatonin if they need to help them either promote sleep a little earlier and get up earlier, or vice versa if they're advanced. Now, some general things with regards to quick guides. Newborns need about 16 hours. 2-year-olds need about 12 and a half. 10-year-olds need 10 and a half. Teens need 9 and a half. And the average adult needs 8 and a half. As we get older, they don't necessarily sleep more. It's just harder for them to sleep well. And because their quality of sleep is impaired, they're more likely to nap or try to sleep in or make up for that poor quality sleep. But their need actually doesn't decrease or increase with age. It's just harder for them to stay asleep, either because they have medical conditions, sometimes medications, as well as naturally, when we get older, our amplitude of our delta waves, which promote deep sleep, decreases. And because of that, it is no longer, it's not no longer, but it's easier for us to be woken from that stage versus when we're really young. So infants, newborns, children have a really high amplitude to their delta waves. So it's very, very, very hard to rouse someone at that age from that stage. And that's also the stage that we have things like sleepwalking, sleep talking, and other partial arousal parasomnias. And what occurs is they're in deep sleep. You have an environmental stimulus that occurs, and it is going to try to rouse the person. But because they're in deep sleep, they can't be easily roused. So it basically promotes a partial arousal. They're not going to remember what's going on, but they will engage in very complex behaviors. Sometimes it's as simple as they will go into a parent's room and stand over the bed and just kind of breathe. Their eyes will probably even be open, but they are not awake. They have no actual awareness of what's going on. For others, it can be texting. I have had teens in my clinic that would sleep text. So they would be completely asleep and texting full conversations. I have others that'll fix meals, things of that nature. These are different than nightmares. Nightmares are going to occur mostly during the latter half of the night, when we have most of our REM sleep. Now, as far as kind of how do we fall asleep and stay asleep a little better, let's talk about some of the good habits that we can get into that help promote sleep. One of them is a bedtime routine. So how do you prepare for bed? How do you do you have a bedtime routine? We often promote this for small children, but it's still important even as we get older, because what this in essence is going to do is behaviorally help our brain, because we associate 4 to 5 activities within getting in bed and attempting sleep, not getting in bed with a cell phone or using electronics, but actual sleep. And our brain then, as we go through these activities, it will help induce a state of sleepiness. So once we get into bed, we're going to fall asleep faster. You also need to pay attention to what's going on in bed and the bedroom. So let's take a look at this next slide. So one of the things to consider is we sleep best in a cave, cool, dark, and quiet. Sometimes what promotes us waking up is because we have environmental stimulus that are occurring that are disruptive to sleep. So while it's really hard to wake us from deep sleep, it's not necessarily hard to wake us from REM or stage 1 and 2. Deep sleep is stage 3, so it's a little different. Yes, animals are very good at doing that, or any bed partner. So if you have small kids that are in bed with you, a pet, a bed partner, anytime you introduce anyone else or anything else into the bedroom, you are running a risk of disrupting your sleep, and vice versa. You could be disrupting the other person's sleep if it's a person. So if we consider some of the things to look for, and I just highlighted, are there noises coming from a TV or a monitor, or noises outside the room that can be heard? Is the door open, closed that allows for an emission of sound or light? Is there noises outside, light coming in from the window? Is there a lamp in the room or some other light source? Are there things that are more interesting to do than sleep? Yes, so sometimes we'll separate beds to help reduce the jostling and whatnot that can occur. So some things that can help act as a buffer. So one of the things I typically tell individuals is we sleep best, like I said, in a cave, cool, dark, and quiet. Quiet does not mean silent. Quiet means we have a consistent noise that is happening throughout the night, but not a high level noise. So what? White noise. Yes. One of the things that works awesome as white noise is a fan. Not a ceiling fan, because a ceiling fan isn't going to make that same noise. You want a box fan or an oscillating fan, and you want to set it on medium or high. If you are super sensitive to noises, it's going to probably annoy you the first few nights. You will acclimate to it after that. You don't want something like music or crickets or ocean, because unless the ocean sound is pretty consistent, because those oscillations in sound can actually trigger an arousal to a full awakening during sleep. We won't realize that that's what's happened, but it will promote a wake occurring. The other thing to consider is consistency of light. So if we have yes, most definitely. If you have inconsistent light sources, so blackout curtains work great to block that. If you have a nightlight that comes on or off, or that is in a position that if you roll over one way, you're going to be able to see it versus another way. So you typically want your sleep environment to be consistent from start to finish. If it's consistent from start to finish, you minimize a lot of the sleep issues that can occur. So doors closed often help. Blackout curtains, an eye mask. Because I know for me, I'm super sensitive to any sort of stimulation going on in the bedroom environment. So I will fall asleep potentially, even with the smoke detector. But in the middle of the night, if I happen to turn and I don't have my sleep mask on, even with my blackout curtains, that smoke detector light is like a beacon in the middle of the night. So eye mask often can help with that as well. Now, when we're talking about sleep and trying to figure out, am I sleeping enough? What's going on? Is something happening? Some of the ways you can have, or some of the signs that there is poor sleep is daytime behaviors. Is there mood affect issues? Are there behavioral problems? Are there neurocognitive deficits like difficulty paying attention, performance deficits, disruption in the family, daytime sleepiness? Other things to consider is timing. So we've already talked about your circadian clock, and where during the middle of the day, or during that midday, having that light exposure is great. But as we move to the nighttime, you really want to promote melatonin onset by starting to dim lights. And that way the brain gets the cue that it needs to start producing melatonin. You can even do this without taking over-the-counter melatonin, because over-the-counter melatonin is often significantly higher in dose than what we actually produce in our body naturally to promote sleep compatible behaviors. How often, when are we using electronic devices? What is the caffeine intake? It's important to know that caffeine has a pretty long half-life. It's about 4 to 6 hours. And it is actually going to decrease that adenosine buildup in the brain that helps promote sleep onset. Other things that can impact is like alcohol consumption. So alcohol consumption can promote sleep apnea symptoms, because it can cause some muscle tone, an increase in muscle tone loss and increased snoring, which can cause poor quality sleep. If you are drinking before sleep, that can also promote some dehydration, which can also result in you waking up in the middle of the night dehydrated. Exercise timing is important as well, because when we exercise, we increase our core body temperature, and we want that lower in order to promote sleep onset. If melatonin is needing to be taken, it's typically best to do so with a low dose. So we're talking a quarter of a milligram, about 3 to 4 hours before bedtime, because melatonin starts to come out 2 hours before bedtime. So what's also important is what kind of exposure are you getting to screens, stimulation, that 2-hour window before bedtime. So if you take about 1/4 of a milligram, 3 to 4 hours, you're going to have the ability to ingest it. It's going to start circulating about 2 hours before bedtime, and it's going to promote those sleep compatible things within the body. Okay. So let's talk in terms of prioritizing sleep. One of the things is first identify what's contributing to your sleep, your insufficient sleep or poor quality sleep. Is it choice? Is it not allowing enough time for sleep? Is it a sleep disorder? Is it something like psychological conditions like worry? Or your bedtime routine should occur about 20-30 minutes before bedtime. And it should end with a calm activity that you do outside of bed before getting into bed. And what that's going to also promote is a decrease in that cognitive activation of worrying and thinking about what's going on or engaging with other people. It's also important to understand that having access to notifications during that time can also be arousing. And so making sure that part of that routine is setting your phone aside and moving through a routine of brushing your teeth, taking a sip of water, going to the restroom, reading a relaxing book, or doing some meditation or deep breathing exercises or those kind of things. So in identifying what's contributing to your insufficient sleep, planning for sleep. So it's important that if you think about it, even as an adult, we need about 8.5 hours of sleep. It is one of the longest single activities you will do in a day. So if you're going to plan all of these other things and not actually make the time for sleep, the likelihood you're going to reduce your sleep period is increased because you're going to plan these things and then go, I'll just sleep whenever I can. It's also not going to promote that regulation of the circadian clock. So one thing that can help is honestly set an alarm clock to remind yourself you need to start getting ready for bed and put your phone up. Having a 2-hour routine depends on what you're doing during the 2-hour routine. If it's more giving yourself a break from tech, light exposure, that kind of thing, not a bad idea. But typically speaking, that bedtime routine itself needs to be about 20 to 45 minutes is typically what I'll tell individuals. Just depends on how much time they need to wind down. The biggest thing is just shutting screens off and stimulation. So not suddenly engaging in something that's super stimulating right before bedtime. Now, other thing to consider is identifying any sleep disorders. So if you have sleep apnea, do you snore loudly? Have others seen you stop breathing or gasping for air? Do you feel sleepy during the daytime? If so, you want to get a sleep study done and you want to be able to treat the sleep apnea. The best treatment for sleep apnea is going to be a CPAP or BiPAP. What that is continuous positive airway pressure. It's going to maintain the airway so it doesn't close during sleep and allow you to have a decent quality sleep. There are some newer technology as well. For instance, there is now a implant that you can get that's going to help stimulate the vagal nerve to sustain wakefulness. What about the reduced blue light settings on tech? Does that help? It can. The important thing to understand with tech right before bed. So I have 2 monitors at my desk. I also have gaming consoles when I game and things of that nature. And even activities that don't involve a lot of light. So I paint. They will often induce a state called flow. And that flow state means we stay in it and we want to keep doing it and we lose sense of really time outside of that state. And so what that can do is it can promote sustained wakefulness at a time when you should be getting ready for sleep. Getting the same amount of sleep, so that goes back to that predictability. And it is that, yes, if you can get about the same amount of sleep every night around the same time, that's going to be optimal, meaning your bedtime and wake time are pretty consistent. Because even a 30-minute delay in your wake time can promote a dysregulation of that internal clock. So other conditions to be concerned about or consider is insomnia, so having difficulty falling asleep or staying asleep, and doing a lot of these things we talked about can help with insomnia symptoms. It's actually part of the treatment for insomnia. Restless legs, this is an unpleasant feeling or tingling. It feels almost like ants crawling up your legs or pins and needles, and this is going to happen before bed in the evening time up until about an hour after sleep onset should be occurring. And the other thing is just looking for those disturbed sleep factors. If you are prone to acid reflux, it can promote OSA-like symptoms because you're having acid reflux in the throat at nighttime. So you want to be cautious of what you're eating before bed and that kind of thing. Noises, light, we've already talked about. If you're needing assistance with sleep, meaning you feel strongly that you probably have a sleep disorder, then you might want to locate either a behavioral sleep medicine specialist, and I've included the link here where you can go and locate one, as well as possibly needing an accredited sleep center. So let's briefly talk about why you might need a sleep center versus going a different route. If your concern is I have obstructive sleep apnea or central sleep apnea, which is a little different, it's where the brain doesn't tell the body to breathe. Periodic limb movement, so this is a periodic kicking that a person does, then they stop. Or narcolepsy, those are going to require a sleep study. If your concern is insomnia, circadian phase delay or advance, non-REM partial arousal parasomnia is like sleep terror, sleepwalking, sleep talking, those kind of things. Nightmare disorder or restless legs, you do not need a sleep study. Those don't actually, a sleep study often doesn't help us to rule that in or out. It's really based on self-report. Okay, so what if you have your schedule, but you're still really struggling with maintaining the schedule? Because how many times on the weekends do we end up sleeping in because it's super hard for us to maintain that earlier wake time because we don't have a main activity? So plan a main activity. Have something that you need to get up to do at about the same time you would on the weekdays. Add in a well-lit area so that way that light is going to really push the melatonin down and allow you to sustain that schedule. The other thing is also incentivize yourself. It is hard to always get up at the same time, especially if we don't feel like we have to get up. So incentivize yourself, because the longer you spend in bed not sleeping, the more your brain starts to associate bed with something other than sleep. So it's important to make sure that you are really only sleeping when you are in bed, give or take about 15, 20 minutes. Move all electronics out of the bedroom, definitely not accessing them in bed. If you have no other place to put them, have a separate area where you use them in the bedroom, but when you're in bed, you're not using them at that point. If you can't fall asleep within 15, 20 minutes or go back to sleep. So someone asked, how do I sustain sleep in the middle of the night? If you're noticing you're waking up and you're not concerned you have OSA or something of that nature, what you need to do is if you can't fall asleep within 15, 20 minutes, and that's that point you're in bed laying there going, I should have already been asleep, get up out of bed, do something in dim light. Don't start turning on a whole bunch of lights, dim light, low key. When you start feeling sleepy, so that's when you start doing the chicken bob, or you're doing this number, or you're noticing your eyes getting heavy, get back in bed. Try to fall asleep again. Rinse and repeat until you're able to fall asleep. This is actually one of the best methods for being able to improve your sleep quality. The other thing to recognize is, as I tell my teens and kids, only one thing happens in bed for them, sleep. As an adult, sleep and sex are the only two things. Everything else gets moved out. I would recommend reading, but not in bed, if you can put your book down. So for me, if I'm reading a fun book, I'm not going to want to go to sleep. So one thing that can help instead is don't read a fun book. Read something that you can easily put down, or if you're not the type of person that you want to stay engaged and know what's going to happen, that's great. Just don't do it in bed, because the more things you associate with bed, the more your brain thinks it has options. So let's talk about what that means real fast. We really want a strong association with sleep and bed. That's going to promote us falling asleep faster and staying asleep. When we do other things in bed, even if it's reading, because that can be stimulating, our brain suddenly thinks we have multiple pathways. We can either stay awake or fall asleep, and it will randomly decide which one it wants to do. It also means when we have about 4 to 5 times a night a brief arousal, our brain might try to pop up to an awakening so it can do something else. And that, again, will promote waking up in the middle of the night. So one thing that's important too is, especially when I work with families and even adults, solitary and co-sleeping. So my rule of thumb is if you have a family bed or a single bed, everybody sleeps in their own bed. Either one, totally fine, but it needs to stay that way from start to end. Solitary sleep is where basically you start, stay, end in your own bed throughout the whole night, or the child does in their own bed. Co-sleeping, child starts, stays, and ends in the family bed. Reactive co-sleeping, this is often which promotes wakefulness in kids or maintains it, is kids will start off the night in their bed, but they end up in someone else's bed or somewhere else. And they become conditioned to actually waking up, and kids are great at this. They will have like synced perfectly timing of when the parent is going to be so sleepy that if they sneak in their bedroom, the parent's not going to put them back to bed. So put bells on the door or a noisemaker, so you are alerted as soon as a kiddo gets up and can put them right back in their bed. Once you start doing that, for a week or two, they will stay in their room because they will condition themselves to staying there throughout the night. Foods that may be helpful for sleep. So some foods that are going to kind of promote sleep are calcium-rich foods, which help promote melatonin production. Magnesium-rich foods can help reduce restless leg syndrome. Potassium-rich foods are going to help promote deep sleep, and things you want to avoid are caffeine, alcohol, fatty foods, and fried foods. Because again, the fatty foods and fried foods are going to feed into sending that disruptive signal. Caffeine is going to reduce your adenosine production, so it's going to help. It's going to make it where you're not building up your sleep pressure like you need to. And alcohol can actually cause awakenings as well as that sleep apnea symptoms. I think I answered most of the questions. The one that I had was, could I go back to the impact that sleep has or dysregulation has on the body? Reading, I'm just making sure I didn't have any additional. Okay, so when we're talking that circadian dysregulation, that disruption can promote things like obesity, diabetes, cancer, depression, suicide. Those are just a few. The reason is because since that master clock's regulating all the clocks in the body, your body is regulating when cells divide and when they die off like they're supposed to, when we release insulin and glucose and not glucose, but insulin, norepinephrine, a lot of your hormones that are super important for maintaining a healthy functioning metabolism, for maintaining health in terms of cardiovascular disease. So when we dysregulate, it's going to increase the likelihood we develop one of these conditions. This right here is just a cityscape of kind of looking at things, because I told you that non-REM or that deep sleep occurs during the first part of the night, and then the REM sleep. You also have these brief arousals. If you're sleeping well, you're going to stay asleep during those. You're going to literally just transition back to sleep. If not, it's an opportunity to wake up. Did I answer the question with regards to what happens when we don't get enough sleep? I want to make sure that I did, but let me go back to the. So what can determine a light sleeper versus a heavy sleeper? Somebody that is a light sleeper is often someone that's more prone to insomnia. So they are more susceptible to sensory input during the sleep period. So that's where having those protections in the room can really help ensure that they sustain sleep. Heavy sleepers are often individuals who are short sleeping, meaning they're not getting sufficient sleep, so they always have extra pressure in their tank. And because of that, they are going to want to sustain this deep sleep beyond the period they should. And it's also going to mean that they are harder to rouse when they're in that state. And so that's typically what we mean when we say light or heavy sleepers. Any other questions? Because I think we have 6 minutes left. Yes, it can. So when we, yes, it is bidirectional. They both can happen in terms of, so the question was, can insufficient sleep cause onset of depression, and can depression, cause sleep disturbance, or rather than depression causing sleep disturbance? Most definitely. When we don't get enough sleep, our mood tanks. We attend to negative information much more readily than we attend to positive or even neutral stimulus. So we are going to encode things in that way. It also impacts how emotional, like your emotional reactivity and that kind of thing. There are connections between sleep disturbance and menopause because we sleep best when it's cool, dark, and quiet, right? And the temperature is maintaining that coolness. During menopause, we start experiencing things like hot flashes. Those hot flashes can trigger an increase in the body temperature and also attribute to a awakening, even at times not when we would naturally have just an arousal and be able to transition. So what can happen is it can cause and promote a dysregulation in the sleep, poor quality sleep, which then causes trouble the next day. Menstrual cycle, so not even just menopause, but the menstrual cycle is also associated with disruptions in sleep. And when our sleep is disturbed, we have a lower pain tolerance, and we're more likely to experience like dysmenorrhea or painful menstruation. Should you try to sleep at the same time every night? Does routine keep? Yes. So both of those. It's not just going to bed. So often we will talk about a consistent bedtime. Honestly, if I have a patient or someone that is needing, that can only really commit to one, your wake time is more important than your bedtime. That being said, if you don't get enough sleep, it's going to force itself on you. But if you need one always consistent, your wake time should be, because that's what sets that internal clock for the day. Your brain part of what can desensitize that is actually when we don't get enough sleep, we won't wake to the sound. We will be wanting to get into deep sleep even at a later time than we should. So what you might notice is it's not so much a desensitization, it's definitely can occur when we are either consistently sleeping insufficiently or we're sleeping at odd times constantly. And you might notice that it's harder to wake up to that alarm certain days of the week, like Monday, Tuesday, Wednesday, before your internal clock syncs up. And now you're following that more consistent weekday schedule. The problem is you're then like 2 days before the weekend before you delay again. But typically that feeling like you're desensitized to it is often when we are not getting sufficient sleep. Changing up the sound can work to an extent. Some other things that work, so I'm hard of hearing. I wear a hearing aid. I have bilateral hearing loss. And I finally had to get a bed shaker. So my alarm doesn't just emit a sound. It also has a secondary piece that goes under my mattress and it vibrates my mattress, waking me up. So if you're struggling with that, I would first look at, am I consistently sleeping, a good duration? Okay, am I still not hearing that alarm sound? Do I need something else that potentially can wake me up or help wake me up? Some of that can be a light with it or a shaking of the bed or something like that. Do I have any other questions? Because we have like 2 minutes left.
So I'm going to jump in here. Somebody asked if we'll have access to this recording. Yes, it will be posted to the HSC YouTube page. We have a playlist that is Fort Worth ISD. So all of the recordings live there. This one will be uploaded this evening. Hopefully it'll be live by tomorrow. So this will be there forever as a resource. Additionally, from my side, for all of the Fort Worth ISD staff and faculty, you will receive the follow-up email probably Thursday. We've noticed that in the past, it takes our computer system a little bit of a lag to get everybody marked as attended. So we're going to put a delay on that. It'll come to you Thursday with the post survey, so you can tell us what you learned and what you liked about it. And I will be happy to share those responses with Dr. Roane. But is there anything else right now?
I think I just had one and I wanted to address it. So adults need 8.5 hours. So can a duration of like 5 hours have the same quality as sleep? Is that sustainable? You will have the same you will have improved quality to an extent. But what's important is just the slide being up here is your sleep period has a set architecture to it. When you wake up too early, meaning you're not sleeping what your duration is, you don't get all of your stages at the quantity you should. Your brain doesn't consolidate going, oh, I need to make sure I still hit this proportion of each stage. It is going to just stop it. And it means you're going to compromise your REM. And your REM is still necessary. You need deep sleep, but all of your stages are important. So it is not the healthiest thing to try to sustain, is really the take-home message with that. Because REM will also force itself. So if you're falling asleep and dreaming almost immediately, it means you're having REM rebound, so you're probably not sleeping enough. I think that was the last question.
Okay, well, thank you so much. I'm going to echo Alexandra's sentiments from the chat. She said the session was very helpful and informative. And I personally agree. I know everybody else here does. This was a very interactive session. So thank you so, so much. We appreciate you taking the time to be here with us today.
Most definitely. Thank you for having me.
Of course. All right. This will be on YouTube for the rest of forever. Use it as a resource. And again, thank you, Dr. Roane.